Welcome back to the Hit and Run Medical Hour now. Here are Dr. Jennie and Dr. Marc.
Yeah, baby.
Oh, yeah. Well,
what's one last vice that might be good for me, Dr. Yates?
One last vice that might be good
We've
for you.
covered coffee before, so let's not do that.
Yeah. How about basking in the sun? Getting a tan.
I love that Mohs chemosurgery.
What?
Mohs chemosurgery is what we use for malignant melanoma.
Oh, okay.
So if you're going to go outside, I have to also recommend that you put on the SPF 30, wear a broad brim hat, stay under an umbrella, and I think then you could enjoy the sun. What would your advice be?
Not for sunscreen.
No sunscreen.
Our rates of cancer have gone up phenomenally, as have our rates of sunscreen use. There's just no two ways about it.
Oh, my God.
Yeah.
That's like trying to correlate CO2 with global warming.
Listen, if you're staying out so long that you need sunscreen, you need to get out of the sun. There's just there's no two ways about it. If you're staying in the sun to the point that you're burning, you need to be out of the sun. If you're staying for extended periods of time, you need long sleeve shirts, the wide brimmed hat, the pants, the whatever.
So what's safe?
Well, I mean, unless you can get a sunscreen at the health food store that doesn't have all of these ingredients that cause cancer.
Okay. So,
but does it taste good? That's my question.
We had to ask Dr. Blum.
Dr. Blum, does it taste good?
Does what taste good? The sunscreen?
The sunscreen at the health food store.
Does
it come in different flavors?
He does not go to the health food store.
I like to sprinkle the sand on the sunscreen. And I won't tell you.
It has a crunchy texture.
Yeah, very good. It goes great with the toe scrapings. Absolutely. More healthy health food store stuff.
That is so gross.
Have you been hanging out with your toxic friends again, Dr. Plum?
My friends are nothing but uplifting and provide only the finest
they're non-toxic,
company.
is what you're saying.
My friends are non-toxic. Absolutely.
So Dr. Blum.
Yes, ma'am.
I had a patient today.
Yeah.
What this morning, in fact, was in an auto accident. They came in.
Hit her or hit he?
Hit he. From a chiropractic standpoint, there's very little we can do for them right now. They're just absolutely acute. You can hardly, put any type of pressure on any part of their neck or upper back.
Okay, neck and back pain.
Neck and back pain.
Have we MRI'd them yet?
No. Not
just in the acute phase.
Just in the acute phase. Not radiating just yet. No reason to
No radicular pain. They don't have any sharp pain shooting down their arms. Yeah. No weakness. No sensory motor deficits.
None of this. No reason to send them out for the MRI just yet.
Okay.
So, from my standpoint, you can do some electric stim. You can do some ice, biofreeze, these type of things.
Massage?
No.
No. Love massage.
Not acute.
It's great.
Not acute.
Oh, come on.
Oh.
Rub it up. It's. I think massage is great for that as long as it doesn't hurt and people tolerate it.
You can barely palpate.
Okay, they don't want to be touched.
Right.
Oh, well, okay.
This is not an option.
Let me get my PDR.
So, what would you do? What would you look at from a medical standpoint?
Well, I mean, the most important thing is to make sure that they don't have, a discopathy or some sensory motor deficit. And barring that, if they just need acute pain relief, just load them up with muscle relaxants, whatever they need to make them comfortable, enough so that they can work on their range of motion and undergo those adjunctive therapies that are so important to their getting better.
That's a good question. When do you? Because I always prescribe stretching and exercise to patient tolerance. Is there a general time frame that you would start prescribing stretching and therapies and exercise right away?
No, exactly as you do, just to tolerance.
Okay.
Don't do pain. The old saying, "No pain, no gain." That does not apply to joints. Okay.
Or injuries,
obviously. Yeah. So if you're in acute pain, you have sharp, stabbing, whatever, severe throbbing pain. Okay, don't push it, but you need to at least try to get to that point in order to maintain your full range of motion. And if medicine helps you do that, well, then medicine is well indicated for that. I have no problem with that.
Okay.
But it has to go along with that other thing. You have to use the heat, the ice, massage, whatever else. You can't just load up on medicine and draw the curtains and go into your bed.
It's funny that you mentioned heat. Heat is kind of an interesting topic because you can read it. You can pull up different articles that say different things. Some say no heat for an acute injury, and then the definition of acute injury really depends. It can last up to 6 weeks. Some people say only 2 weeks. At what point do you start prescribing heat? Because I definitely say absolutely not for 2 weeks, probably not for 4 to 6. It really just depends.
In the acute phase, yes, obviously you want to try and use cold, but there is no 100% solution to these things for all people. If somebody tells you ice doesn't help me, but heat definitely relieves my discomfort, then who am I to argue and tell them, I don't care, throw away the thing that works and makes you feel good and use the ice.
That's true.
You have to listen to your patients as well. So, yeah, we generally recommend ice in the acute phase of any illness to reduce the swelling, edema, and all these other things. But, yeah, if somebody feels that heat's helping them, by all means, try it.
As long as what I always want to make sure is that they're not having pain after the relief. If they're not having worse pain the next day, that night, whatever it is later on. Hey, where I used to work previously, there was an MD in town, and anybody that sprained their low back, he would tell them heat. Heat, 15 minutes, every hour. And they all got worse.
That's good for you.
It was so good for us.
Oh, I'd like that, doctor. I'd buy him lunch.
It was the worst recommendation ever. Poor guy. It was terrible for the people. But, immediately when we took him off the heat, put him on the ice, did some adjustments, they all got better just really quickly because the guy was giving them just not the best advice for an acute injury. Well,
there are many physicians that are trained in internal medicine and other things, and they don't really have a firm grasp of musculoskeletal disorders and acute injuries, things like this. And so they just give some benign advice that they don't think will hurt anybody. It's well-meaning, but not well-studied. That's all I can say.
I gotcha.
Ice, in general, is worth a handful of pills. And I can't recommend it highly enough to my acute injury patients, especially patients with elbow effusions, tennis elbow, knee effusions, knee sprains, all these kinds of things. Ice, and more ice. Very important. But people don't want to use it because it doesn't cost money. It's not a pill. It's inconvenient, and it takes time.
Yes. Mm-hmm. As all conservative things do, they tend to take time because it requires time for the body to heal itself. What was it? I had a. There was just a patient I was going to ask you about.
So how's your patient doing with that severe whiplash?
I just saw her this morning, so that was the first time.
So she has 60 more treatments to go.
Oh, that's terrible.
Did she must have felt some relief after your session?
A little bit.
Of course she did.
But we still recommended that she went back to see her primary care physician to see if they had any recommendations for medication-wise.
Sure.
So. We're not that type of chiropractic office. Although I did hear of one the other day. Well, I'm not even going to say that.
Okay. But let's keep going.
A lot of treatments.
Any other good cases?
I have one, actually.
Yes, sir.
No, a good friend of mine had whiplash when she was 22. Now she's 63. Yeah. 40 years down the road. And,
it's one of those hidden injuries.
Yeah, and the neck is giving her an enormous amount of pain. Well, she went to a chiropractor today, I guess, and found out discs, something with the discs are rubbing together or something. Anyway. Well,
did she have a study? These are things you can diagnose just by plain films. Plain films may suggest certain things, but the only way you can really well-define the disc problem is through an MRI or CAT scan.
Okay.
Did she have that?
MRI. I don't think she had an MRI.
She may have had disc desiccation, or she may have some arthritis in the joint, showing that the disc was degenerated.
Perhaps.
She thinks maybe arthritis. She did mention that.
Wait a minute.
Since she won't call in,
and how old is she?
She's 63.
She is 63.
Yeah.
Well, that's still awfully young to have any kind of chronic pain in your neck.
And back now. Now the back's bothering her.
Has she missed any ballroom dancing, or has this interfered with her general quality? Has this interfered with the quality of life at all?
Yeah, she just got back into dancing big time, ballroom dancing, and all kinds of dancing.
How long has it been bothering her overall?
Probably,
Overall and then recently.
Well, the neck's been a problem forever, but recently, as in the last 2-3 months, it's been worse and worse and worse.
Did she do anything in the last 2 or 3 months ago that brought it on?
Don't know.
Okay.
No injuries or anything that I'm aware of.
Well, no, seriously. If this thing is dragging on for a couple of months and she's miserable, get her in. Let's take a look at it and see what we can do to help her. Some people just enjoy their suffering. We can't help them.
No, that's not the case here. No.
But there's no need for it.
That's a strong possibility, I come to think of it.
Come on.
There's a lot of secondary gain, for sure.
What? Actually, I can never understand that. People come in and they had a neck pain or a back pain for... You ask them, okay, how long has this been going on overall? 23 years. Okay. Does this affect your activity? Oh, yeah, I haven't been able to golf for 23 years. Really? I haven't been able to, XYZ for a year, for 2 years.
It sounds like the couple that went to divorce court. He was 98 and she was 97. Wow. And the judge asked them, how long have you been married? And they say, 72 years. It says, 72 years? What have you been waiting? How long have you been miserable? 72 years? Well, what are you waiting for? Well, we wanted to wait until the children died. Boom! So, yeah, there's no need to put these things off. We can reach an amicable settlement here and help your friends. So please, by all means, ask her to come in and give us a call.
Us.
Us.
Do you guys work together?
Sometimes.
Who's us?
Well,
Dr. Jennie and Dr. Marc?
By all means, have her see Dr. Jennie.
My office is in Clearwater, Core Health of Clearwater. His is in Carrollwood. Occasionally, I definitely will head over there to see patients in his office.
I just do what I'm told.
I did it one time, but really, when I go over there now, it's just to help out in his office, not as a chiropractor.
Well, so, I will tell her. Thank you.
You're welcome.
Absolutely.
We can guarantee one thing.
Yes, ma'am.
She's going to get good care at either one of our offices. Every time, I can guarantee that.
We will do the very best we can to help her. I had a really tough case this afternoon.
Oh, yeah?
Yeah, patient, middle-aged lady with HIV. And these are some of the most difficult patients we confront.
What's HIV?
Husband is a village idiot.
Oh,
almost impossible to treat both the patient and her husband.
Did she have a neck pain or a pain in the buttocks?
I don't know. Ultimately, it was my pain that concluded the interview. I sent her out for some studies, and we'll see her back when her husband can't make it.
That's actually the opposite of what needs to happen in our office. Because if ever, husbands should almost never be allowed in without the wife or the girlfriend. Without.
Yeah.
Okay. Because they always give the full story.
Yeah.
How are you doing today?
I'm fine.
I'm fine. I feel pretty good.
Yeah. No, he's not.
No, my
he
back,
can't move.
Exactly. And no kidding. I had patients in another office. The husband came in. How have you been doing? I've been doing phenomenally well. I was even able to wash and wax my truck this weekend. No problems, no pain.
That's a sign of wellness.
Well,
taking care of your truck, yeah.
Well, doing the activities of daily living. Anyway, after lunch, the wife came in.
Mm.
Oh, I heard so and so's doing really well. He said he washed and waxed his truck this weekend. He's doing well. He said what? He had to keep stopping every 20 minutes because his back was bothering him so much. That's why he came back in after 6 months. I said, I was wondering why he came back in and then said he was fine. He just wanted a tune-up. The wife always has to come in, or the girlfriend.
So ultimately, who do you treat? Do you treat the patient or the spouse?
Well, I just, in order to get the full information, often it's the spouse. We get the information from the spouse, but we're treating whoever has the pain, who has the problem. Or the alignment. Sometimes,
may I just give you the benefit of an additional 30 years of clinical experience?
You know what's funny, Dr. Blum?
Yes, ma'am.
I looked at how long you've been licensed, and it's almost as long as I've been born. It's almost as long as I've been around.
Absolutely.
I appreciate your clinical experience.